So in today's session, we'll be doing the chapter on diet in cardiovascular diseases, chapter 16, page 322. Those who have the textbook, it's page number 322. If anyone is joining late, please help them out with the page numbers and the topic name. The diet in cardiovascular diseases, CBD and CHD. Okay. Cardiovascular diseases, CBD stands for cardiovascular diseases, CHD stands for coronary heart diseases. Okay. That is the full form. So cardiovascular diseases is a group of conditions including angina and myocardial infarction, heart failure, cardiac arrhythmias, and heart valve problems. It usually affects the heart as well as the blood vessels because it is cardiovascular diseases. All the blood vessel related diseases will also come under this particular name. Okay. Coronary heart disease is a subtype. It's a type of a cardiovascular disease, but here only the blood vessels, specifically the coronary artery of the heart, is affected. Coronary arteries are the blood vessels that carry the blood towards the heart for the oxygenation of heart. Okay. Heart receives its blood supply from coronary arteries. Okay. So these coronary arteries, they get affected by plaque formation, atherosclerosis. That's what we call as CHD. So CVD is an umbrella term. CHD is a part of the cardiovascular diseases. Okay. So don't get confused between these two words. Atherosclerosis is a man-made disease. Okay, it's based on your lifestyle. Because of the lifestyle, you get disease conditions like atherosclerosis or plaque formation in your blood vessels. So this is how the atherosclerosis looks like. You can see the coronary arteries provide blood supply to the heart on the surface of the heart, and narrowing of the coronary artery happens because of the plaque and the cholesterol, the fat accumulation within the artery. Okay, because of this narrowing of the artery, the blood supply towards the heart is also reduced. And when it becomes completely blocked, the coronary arteries, when they become completely blocked, the part of the heart muscle which was supposed to receive the blood supply suddenly will not receive any blood supply. It will undergo necrosis. Okay, that's how you get myocardial infarction, heart attacks. Okay. Prevalence. It is the cardiovascular diseases are the leading cause of death in many countries worldwide. Okay, and CHD is a highly predictable, preventable, as well as treatable disease based on the lifestyle. It is predictable. Okay, it can be prevented with lifestyle changes, medications, and once you have been diagnosed with certain disease conditions like cardiovascular diseases, it can be treated as well. Okay, am I audible to all? Even in India, the onset of CVD is at a very early age as compared to the Western side. It's more severe, and the progression of cardiovascular diseases is very aggressive in India. Okay, because of the Indian genetics, we do not since India has suffered from a series of um, famines, okay, series of famines in the past 2 centuries, and it goes back to 3 centuries as well. So because of this famine, we have a starvation gene in the Indian population. Starvation gene is kind of a genetic mutation that has took place in the Indian population, because of which Indians can survive on very little food. Okay, the body to overcome recurrent famines that took place in our history. Okay, some of the famines were man-made as well. The Bengal famine in the 1930s. Okay, it was man-made, created by the British rule. Okay, so because of these continuous famines, the Indian population had undergone. We have a starvation gene that has been activated, which helps us to stay alive even with very less amount of food. So as soon as modernization took place in India, Indians got access to variety of food. Okay, the hunger rate in India reduced as compared to independence and post-independence. Okay, after few years, the rate of hunger, the rate of poverty, okay, was slowly reducing. People had more access to more food, and what happened was diabetes mellitus happening in India at a very young age, as well as diabetes and cardiovascular diseases affecting Indians who are very lean. In the Western world, it was isolated. Diabetes and cardiovascular diseases were isolated to people who were overweight or obese. But in India, even the leaner population, okay, they get diabetes, they get cardiovascular disease. You don't have to be obese or overweight to get cardiovascular diseases or diabetes in India. This is because of the starvation gene that has been that went under a mutation over the period of years because of famines. Okay, Indians, in the most natural way, the Indian population is supposed to survive on very little amount of food. Okay, it's a survival factor to overcome recurrent famines. Okay, that was the purpose of this gene. But now, if we do not face any famines anymore, okay, but Indians have accessibility to more than enough required amount of food as well as junk food. Okay, so there is an imbalance, there is a disbalance created here because of the too much accessibility of the food and the starvation gene, which is still functional in the Indian genetics. Okay, so because of this, Indians have a very rapid and aggressive way of uh, going to the final stages of cardiovascular diseases or diabetes mellitus turning to be fatal at a very young age. Okay, so this is the reason why. Especially people who are in the higher socioeconomic group are the first one to adopt an advanced lifestyle because of the high saturated fatty acid life. They have a very sedentary lifestyle. There is no agriculture. Okay, that it is available. You can check online. Okay, so saturated fatty acid diet, sedentary lifestyle, smoking, alcoholism is very prevalent and rampant in urban India. This is one of the reasons why urban population in India suffers a lot from cardiovascular disease as compared to the rural population. So cholesterol results, when you do your blood work, okay, like this is how the cholesterol results look like. Okay, so if your cholesterol level is less than 20 mg per deciliter, it's normal. You do not have cholesterol issues. If it is between 200 to 239 mg per deciliter, borderline high level, here if you do lifestyle changes, you can still come back into the desirable level. Once you cross the 240 mg deciliter mark, okay, you come under the high cholesterol category. High cholesterol category are the predictable category where it's known that some cardiovascular diseases may already have started or you are approaching the onset of cardiovascular diseases. HDL values and triglyceride values and LDL values are also given. So the same table that you see here is given on page number 323 as well. Deciliter. So total cholesterol, if it is less than 200, it's a healthy category. Okay, low risk of heart diseases. If it is 200 to 239, borderline risk of heart diseases. And high is when it is more than 240. Okay. LDL cholesterol, that is what we call as bad cholesterol. Okay, low density one. So that is less, if it is less than 130, desirable. Uh, Higher than 160 means risk of heart disease. HDL cholesterol, which is also termed as good cholesterol, high density, 60 and higher is desirable. 50 to 59 is borderline, and if it is too less in the bloodstream, that is less than 50 mg per deciliter, that is high risk of heart diseases. Triglycerides should stay less than 150 for desirable levels. If it is 200 or higher triglyceride levels, it still comes under high risk of heart diseases. So coming to the risk factors of cardiovascular diseases have been categorized into 4 major category 1, 2, 3, and 4. Okay, the snapshot of all these categories are shown on page number 323 table. It's not table, it's the last tabulated form. Table number they have not mentioned. On page number 323, a snapshot of all the categories they have given. We'll discuss that in detail. So in category 1, cigarette smoking. So cigarette smoking will increase your uh, heart rate, blood pressure, and it also lowers the HDL value, HDL cholesterol, that is the good cholesterol, high density lipoprotein, that gets decreased because of smoking. And as soon as the HDL value decreases, automatically the LDL, low density lipoprotein, that increases. Okay, so automatically the person goes into the risk of cardiovascular diseases. As soon as a person has suffered from a heart attack, and after heart attack, when they quit smoking, okay, it has been seen that the second round of heart attack has been reduced. Okay, their lifestyle has improved and their heart rate is normalized. Okay, even after getting one heart attack, if they quit smoking, their heart health improves. That has been seen. Then high saturated fat diet, high cholesterol diet. So it increases plasma cholesterol level. It promotes the formation of erythema. Erythema is atherosclerosis, plaque formation in the blood vessels. So high saturated fat is found in egg yolks, butter, meat fat, okay, ghee, coconut oil, hydrogenated fats like vanaspati, okay, the dalda, they all contain high amount of saturated fat. So taking food that is made with high saturated fat, okay, saturated fatty acids, that also puts you into a risk of cardiovascular diseases. Next is elevated LDL cholesterol. There is a lot of epidemiological reasons why LDL cholesterol is elevated in Indian population, and the reason or why they go into the stages of atherosclerosis. Basically, the gene factor which I have told you, that is one of the reason. Diet that is high in saturated fatty acid, stress, urban population, urban lifestyle. Okay, that also elevates the low density lipoprotein because accessibility to junk food, accessibility to high saturated fatty acid diet is very easy in urban population. Okay. It about coconut oil, you have to be very careful Coconut oil is really good for health. It is good for cardiac health as well, but the way how you use it. Traditionally, if there are any South Indians in the participants, they can also back this. Traditional food that is made in coconut oil. Okay, let's say you are making one sabzi in a coconut based sabzi or toran or something like that in coconut. Okay, how much oil is required to create a traditional South Indian food or cuisine? Okay, even if you take sambar for that factor, a coconut oil is used in sambar as well. How much of it is used? If, for example, if you're making 1 liter of sambar, okay, just imagine the quantity 1.5 to 1 liter of sambar. How much coconut oil will you use in the sambar? Those who are from the southern India in the participants, they can answer you in the chat box. Yes, for 1 to 1.5 liters sambar, you will hardly require 1 spoon or 1.5 spoon of coconut oil, just for the tempering purpose, seasoning purpose. The same goes for majority, 90% of the vegetarian dishes. Okay, non-vegetarian dishes, it depends how much you have to use, but for vegetarian dishes, hardly 1 to 1.5 tablespoon of coconut oil is used for tempering. Okay. So the use of coconut oil, even though coconut oil is a saturated fatty acid, the way how it is being used traditionally, okay, they use very less amount of it, very less amount of it. Okay, as compared to the Indian cuisines, southern cuisines are not that fat forward. Okay, even the use of paneer etc. is very rare in the southern community. Okay, the ghee also, paneer ghee, whatever is used, ghee is usually used for dessert preparation. Okay, traditionally there are very rare recipes in which requires the use of a ghee to be made. Okay, so, health wise, the southern Indian diet, vegetarian diet, as well as the coastal diet, which has fish curries, okay, it is much more health forward as compared to North Indian diet, because it is not fat forward. Okay, it is not fat forward per se. So the way how coconut oil is being used traditionally, that prevents heart diseases. Okay, it promotes good health. The use of virgin coconut oil, as well as coconut oil in a very less amount, it promotes good health. It does not lead to cardiac health. But if you overdo it, okay, on a daily basis, if you eat banana chips or anything that is fried in coconut oil, that will definitely lead you to cardiovascular diseases. Okay, the way how you use it is important. The amount, the portion size, how you use it is important. Okay. What happens here is you have to go back to the genetics. Okay. The way how people from the south, their body, their health responds to coconut oil, do you think it will be the same way how a person who is from northern India, okay, their gene pool is also from North India, the way how their body is going to respond to coconut oil, is it going to be the same? It's not going to be the same. Okay, if you put mustard oil, if you switch coconut oil with mustard oil or any other seed oil for the South Indian diet, they will rapidly develop some of the other disease conditions. Okay, because the genes support you. You have been following this particular diet pattern for generations. Okay, your body has the capability to overcome certain disease factors. Okay, you have to remember that. For example, diabetes has become much prevalent in southern India when chapatis and wheat-based diet were introduced. Okay, nowadays in the diabetologists and all, they they ask they ask diabetic patients and cardiovascular patients to reduce the use of wheat and chapati in their diet, and they have shown much better results just with rice based diseases, because genetically your body approves the digestion and metabolism of rice as compared to wheat. Okay, this is the reality. But usually it is usually because of the North Indian lifestyles of the way how the North Indian body will respond to wheat is not how the South Indian body will respond to wheat. Okay, North Indians will not have that sudden spike of glycemic index after eating chapatis as compared to South Indians. Okay, so this is the reality. Your genetics has to support the digestion and metabolism of the grains that you use. Okay. So elevated low density lipoprotein because of various epidemiological reasons, hypertension, okay, that is an independent risk factor of both cardiovascular diseases as well as stroke. Okay, there are many reasons to hypertension. Hypertension is also a symptom to various other disease conditions, such as who are at risk of hypertension, people who are obese. Okay, they have people who have insulin resistance, glucose intolerance, uh, stressful lifestyle, people who have some renal insufficiency, kidney diseases. Okay, these they have higher risk of hypertension, and higher risk of hypertension or living with hypertension for a long time, that also increases your risk for cardiovascular diseases. Next we have is thrombogenic factors. So myocardial infarction, once it has developed, okay, there are high levels of fibrinogen that is being circulated. Once a person has suffered from a cardiovascular disease or they have undergone heart attack, fibrinogen is a blood clotting factor. Okay, the presence of fibrinogen is required to clot your blood, coagulation of blood. You get hurt, okay, you bleed a little, and then the blood clot forms. Okay, that's because of various blood clotting factors. You have around 12 to 13 blood clotting factors. Fibrinogen is one of them. So there is an increased level of fibrinogen, circulating fibrinogen in the people who have cardiovascular risk, and because of which any point of the blood vessel or in anywhere in the blood vessel, a thrombus can be formed. Thrombus means blood clot. Blood is still circulating, but some part of the blood, because of the activated fibrinogen, because of the circulating fibrinogen, blood clot will form randomly anywhere in the blood vessel. Okay, usually it happens near the plaque as well. Wherever atherosclerosis has took place, there also the thrombus formation, the fibrinogen will get activated, because naturally you can imagine plaque is kind of narrowing the blood flow, and when you have a very narrow place for the circulating blood, will the blood flow have speed or will it slow down? Wherever atherosclerosis is or plaque formation has developed, if you just take that particular part, will the circulation slow down or will the circulation maintain its normal speed? It slows down. So as soon as the blood circulation slows down, and remember the fibrinogen activity is also elevated. So as soon as the blood slows down, it gives the chance for the fibrinogen to form a blood clot then and there itself. Okay, because stagnant blood is more prone to get thrombus factors, like it will lead to thrombus formation as compared to circulating blood. So wherever the blood slows down, there a thrombus formation takes place. Okay. So category 1, is it clear to all? Next is category 2. So this is underlying disease conditions like diabetes mellitus. Patients who have diabetes mellitus have threefold greater risk of developing cardiovascular diseases, coronary heart diseases, as compared to general population. Because diabetes will eliminate the protection that coronary artery disease can have because of the female gender. Even if you're of a female gender, you have diabetes mellitus, you will not have the protection of the estrogen that protects you from cardiovascular diseases or coronary heart diseases. Because of insulin resistance, blood lipid abnormalities like high LDL levels, hypertension, obesity. Okay. Type 2 diabetes mellitus has the biological risk factor of developing cardiovascular diseases and coronary artery diseases. Then physical inactivity, sedentary lifestyle, low cardiorespiratory fitness, that is not doing any cardio, not running, not walking. Then low LDL cholesterol. Millets will be better digested as compared to wheat, because millets don't have the gluten. Wheat has gluten. That's the reason why when you have wheat based food, you feel full for a pretty long time. Okay, because gluten is a protein that is activated. So millet based diet is promoted. The reason being it is easily digested. Okay, and it's also, it naturally has low glycemic index as compared to wheat and rice. It has naturally low glycemic index. So that's the reason why millet based diet is promoted. Okay, for Indian population, millets are really good grain because of the uh, epidemiological factors we Indians already have of developing diabetes and cardiovascular diseases early on in our life. Okay, usage of millets are good. Ragi, jowar, bajra, etc. So, cigarette smoking, obesity, post-menopausal status, like females who have understood and who have got menopause. Okay, in these situations, automatically your LDL, okay, LDL reduces. Jowar is good millet. It's a good millet for people who suffer from diabetes mellitus. Okay, it has low glycemic index. So if you want to raise your LDL values, limit your alcohol consumption, start doing aerobic exercises, and your genetics also plays a lot of a role when it comes to having HDL or high density lipoprotein concentration or not. To reduce a low density lipoprotein, first of all, reduce saturated fatty acids from your diet, get physically active, quit smoking, reduce your alcohol consumption or completely stop the alcohol consumption. So these are the factors through which you can reduce the LDL level in your blood. Next is obesity. There's a direct relation to coronary heart diseases and obesity. Hypertension, sedentary lifestyle, glucose intolerance, naturally low LDL, HDL levels in the blood, and high triglyceride concentration is seen in obese people. And specifically the abdominal fat, the belly fat, Okay, you may have a very lean outlook, but if you carry a lot of abdominal fat, belly fat, pot belly fat, naturally your risk of cardiovascular diseases increases. Then the postmenopausal status. Menopause is associated with uh, heart diseases, immediate rise in the risk of heart diseases, because the estrogen hormone is no longer secreted. Estrogen is a hormone that protects females against cardiovascular diseases. Okay, so after menopause, since the estrogen hormone is not being produced by the woman, that leads to increase in the risk in cardiac health diseases. Category 3, psychological factors. This is depression, stress, social isolation. In these situations, naturally your exercise reduces. Okay, you don't work out, you don't go out. So poor relationships with your family, with your friends can also literally hurt your heart. It could lead to heart diseases. Having good social circle is important. Then elevated triglyceride levels. Again, that is largely because of diet, alcohol consumption, smoking. Then elevated lipoprotein, we have discussed about the lipoprotein, the LDL, specifically the low density lipoprotein, when it is increased due to various many causes, specifically through diet, or your own body has a lot of cholesterol. When it is trying to process the cholesterol, those get attached to the plaque formation or atherosclerosis. Elevated homocysteine. So again, homocysteine is a protein that regulates the lysis breakdown of RBC. So people who have too much of homocysteine, hyperhomocysteinemia, too much of homocysteine in their body, that automatically that is atherogenic by causing oxidative damage to the LDL. So automatically it will lead to more LDL in the body. Hyperhomocysteinemia, if you break down it, hyper means too much, homocysteine is the protein, amia means in blood. Too much homocysteine in blood, more than normal levels of homocysteine in blood. So too much homocysteine in blood is also a marker for any blood-related diseases. So if you take certain supplementation, like pyridoxal phosphate, that's a supplement, it can also reduce the homocysteine levels in the blood. High levels of homocysteine can actually damage the walls of your artery. If the walls of your artery becomes weak, those weak areas have more susceptibility to develop plaque or atherosclerosis. Okay, if you have a healthy heart vessel wall, your arteries have healthy, strong vessel wall. Okay, plaque formation usually does not take place. It only affects in the areas which are weakened. Okay, the muscles in the arteries, okay, they are weakened. The walls of the arteries are weakened, but those areas have more susceptibility to develop plaque or atherosclerosis. And sometimes it may burst open as well, leading to, if it happens in your brain, it is hemorrhagic stroke. Then oxidation and antioxidant. Oxidation of lipoprotein and LDL lipoprotein leads to heart diseases. And why this oxidation is taking place, you do not take enough amount of antioxidant in the diet. Okay, so studies have shown that if you take antioxidants in diet, specifically flavonoids, which you get from tea, green tea, Okay, and coffee also has flavonoids to a certain degree, and colored vegetables and fruits like beta carotene based. Uh, Beta carotene is the factor that gives color to the fruits and vegetables, yellow, orange, red color. Having tea, moderate consumption of vitamin E. Okay, they if your diet is rich in all these factors, naturally there will be a decline in the coronary heart disease event later on in life. So taking more antioxidant rich diet can also prevent cardiovascular diseases. Then alcoholic beverage consumption. Individuals who consume moderate amount of alcohol, uh, they have a lower percentage of cardiovascular diseases or coronary heart diseases. But it's better to abstain, even if it is shown that they do better than the people who abstain. But doctors will never promote alcoholism in anyone. Okay, if you do not drink alcohol at all, it is much better. You are already in a good way to health as compared to people who consume it on a daily basis, even in moderation. Okay, because even if you're consuming alcohol in moderation, alcohol gives you calories. If you're not able to burn those calories over a period of time, it will lead to obesity. Okay, even if you are a very moderate consumer, over a period of time, it will lead to obesity. Okay, there are various reasons that would lead to sudden heart failure that we have discussed in last week's Wednesday class, which has been uploaded already. So you can check the last week's Wednesday class, disease conditions playlist. Coming to category 4, age. The incidence of the disease will increase with age. And if you are female, after menopause, there is a rapid increase in the risk of developing coronary heart disease. Sex, it is much more in men as compared to women. But after menopause, this is completely like different. Women have more susceptibility to develop cardiovascular heart disease as compared to men because obesity and overweight issues are more common in women as compared to men. And also, women who take oral contraceptives on a regular basis, they also have a risk of developing cardiovascular diseases. Family history, the risk of CHD runs within family as well. There are 30 genes that are involved in this disease process. So definitely family history, and if your grandparents or your parents suffer from cardiovascular diseases, there are high chances that you are also looking forward that pathway. If your lifestyle aligns with a good health, or if your lifestyle aligns with the risk of cardiovascular diseases, you will get it earlier than your parents or grandparents. So development of atherosclerosis. So in the initial stages, small plaque formation takes place in the lining of the artery, okay, which is preventable with lifestyle changes. With when you increase your physical activity, do more cardio in your regular physical exercise, it can be taken care of. This plaque can dissolve completely, it can move away. But if nothing changes, the plaque will still grow. Okay, the lining of the artery will also undergo damage. Okay, because of the pressure of this plaque on the artery while it is growing. Okay, and after certain time, when the plaque is in a mature state, the plaque will get its own blood cells as well. Okay, blood cells or blood supply as well, and because of which it can undergo rupture also. Sometimes the plaque can still undergo rupture, and Because of this rupture, blood clot will also form that leads to thrombus. Okay, blood clots, when the blood clot is formed here, you can see here, along with the plaque, when the blood clot has formed, how narrow the lumen of the artery becomes. Okay, so this is where you get the myocardial infarction and other necrosis, other situation which require surgery or other invasive treatment. Okay, so this is a transitional phase for the plaque. The initial stage, it is just the plaque formation, just the deposition of cholesterol. It can be prevented, it can be removed with physical activity. Then if the vessel continues in the same way, the plaque will still grow, okay, but it will damage the lining of the artery where it is growing. And after a point, if randomly if the plaque undergoes a rupture, since it has also received its own blood cell supply and all, if it undergoes rupture, blood clot will form within the artery lumen, and that will further reduce the area which the blood has to flow. Okay. So this is how atherosclerosis develops into a thrombus formation, a clot formation within the artery, and then after the thrombus formation, stroke or myocardial infarction will follow. Coming to the treatment, in textbook, they have mentioned a lot in detail about this development of atherosclerosis, but that is not required. It's from a medical point of view. Okay, a lot of medical terminology, technicalities has been shown here till page number 332. You just have to go through. If you are interested, you can read it. Okay, but major questions will not come from there. So these are the principles of treatment which we have for people who are living with coronary artery diseases. So first is the dietary management, and then certain medications like drugs that does not come under dietetics, but I'm just showing you the principles of treatment that cardiologists usually follow. So dietary modification should be done. Some medications the patient will be put on. Exercise routines will be taught to them. Smoking has to be stopped completely, smoking cessation. And if they have a very stressful lifestyle, stress management also has to be done. So coming to the dietary management, the first principle, low calorie diet has to be provided here. Low fat diet, specifically low trans fat diet, low saturated fat diet, low cholesterol diet. Low cholesterol means no animal fat, reduce the animal fat, uh, reduce the butter ghee usage in the diet. High polyunsaturated fatty acid, that is omega-3 is to omega-6 ratio, should be around 4 to 10 parts of omega-6, 1 part of omega-3. Okay. Low carbohydrate diet, protein levels can be normal, high fiber diet is promoted. So fats, polyunsaturated fatty acid are naturally found in these oils. Okay. Omega-6 is on the left side, omega-3 rich foods are on the right side. Okay, so including these oils is if you switch your butter, ghee, okay, coconut oil as well with these oils, it will give you much better results. Okay, if your use of coconut oil was rampant, if you were using too much of coconut oil in the diet, then you have to switch it with these oils. So olive oil, wheat germ oil, grapeseed oil, pistachios, sesame oil. Sesame is a gingery seed oil. Okay, hemp seed oil, pumpkin seeds, chia seeds oil, sunflower oil, cotton seed, raw nuts and seeds. Okay, They are extremely high in omega-6 fatty acids. That is polyunsaturated fatty acids. Omega-3 rich food, soybean, canola oil, mackerels, flax seeds, kidney beans, chia seeds, walnut, spinach, salmon. Okay, out of this, mackerel and flax seeds. Mackerel and flax seeds have the highest amount of omega-3. No, wheat germ oil is different from rice bran oil, I guess. I don't think they both are the same. Taking flax seeds on a daily basis, taking fish oil on a daily basis is a good option for maintaining your cardiovascular health. So here you can see oleic acid content by different oil. Oleic acid, linoleic acid, these all are different forms of polyunsaturated fatty acid. So the higher the oleic acid, that oil is best for cardiovascular people who suffer from. Yeah, olive oil can be used in making veg. Okay. Alpha linoleic acid, oleic acid, linoleic acid. These are different types of polyunsaturated fatty acid, omega-3 fatty acids. Okay. Canola oil, olive oil, soybean oil, sunflower oil. Okay. Peanut oil they have given here, it only has 48% of oleic acid. Coconut oil has the least percentage of oleic acid. So the best oils are going to be olive oil, canola oil, soybean oil, sunflower oil. Mustard oil and canola oil, they both have the same content. Okay. Canola oil you see here. Omega-3 fatty acids are also found in different types of oils, but in a very less amount. Flax seeds naturally have high levels of omega-3 fatty acids. Okay, that is the reason why. The top 5 oil you see here is recommended. The one that has higher oleic acid percentage. Am I audible to all? So while purchasing oil from market, okay, go for the oils which has this egg mark logo, FSSAI logo, or the Bharat Sarkar Government of India egg mark logo. Okay, this only buy blended oils which have this logo. Look for the constituent oils in blended edible oils, and make sure that you look for the egg mark logo. That would be the ones recommended by the government. Okay. Why blended oils? Blended oils means different types of oils in different ratios. They are blended together and they are kept for sale. Okay. Blended oils you can make at your home as well, but do only in small batches. Okay. When you blend the oils, two different types of oils, there are high chances that if you keep it for a longer period of long duration, it may get spoiled. So on a weekly basis, you can make small batches of blended oil at your home. Okay. Otherwise, you can buy blended oils directly from the market as well. When you're buying blended oils from the market, go for this egg mark logo. Okay. It means it is tested well. It is tested well for human health and consumption. Okay. So those who have the textbook, if you check page number 337, table 16.5, okay, there are different combinations of oils that are given. Okay. For example, uh, GNO is to MO. Here GNO stands for groundnut oil, MO stands for mustard oil. Okay, the short forms also they have given. Uh, what kind of oil that the abbreviations have been given here. Please refer that as well. So 3:1, when we say 3:1, it does not mean 3 parts of groundnut oil and 1 part of mustard oil. Okay, you have to minus 1/3. So it means 2 parts of out of if it is 3 parts, 2 parts should be groundnut oil, 1 part should be mustard oil. Okay, so when you at home when you're preparing the blended oils, this is how you have to prepare. So when you mix blended oils, when you blend two different types of oils, they give you a much better advantage of having maximum polyunsaturated fatty acids. Okay, some oils are naturally less in oleic acid, but they have other good factors. Other alpha linolic acid is present. Okay, so some oils are higher in oleic acid, but they do not have enough amount of alpha linolic acids. So to compensate that, we are blending two different types of oils. Okay, so that they complete each other, just like how we use combination protein. Okay, yeah, 3:1 means you have to use 2 parts of groundnut oil and 1 part should be the mustard oil. 3:1. 2:1 means you have to use 1 part of groundnut oil, 1 part of canola oil. All these blended oils are good for cardiovascular health. The ratios they have given on page number 337, all these blended oil ratios are good for cardiovascular health. Okay. Again, 1:3 also means you have to give 2 part one oil, 1 part the other oil. Okay. Don't get confused about the ratios being switched. If the bigger number comes first or smaller number comes first, just read what they represent. Chia seeds regularly you can eat. That is also good for calcium consumption. Okay. Not just for polyunsaturated fatty acid, but also for calcium intake. Chia seeds, taking chia seeds on a regular basis is good for health. The best way is to soak chia seeds. Okay. Soak chia seeds in water. The next option for a good heart health is low sodium diet. Reason being, all the cardiovascular diseases has this common symptom of having high blood pressure. Okay, to tackle that, low sodium diet has to be given. So, page number 16 table 16.7 on page 338. Sorry, 339. Page number, this page number given is of old textbook. In new textbook, it's page number 339. Yeah, related oils are available in the market. Different brands produce the blended oil. It's not a particular brand. The only thing you have to look is Eggmark logo. Don't go by the brand, go by the logo. All the major companies and all the major oil manufacturers, vegetable edible oil manufacturers have their blended oil segments as well. Look for the Eggmark logo. Okay. So coming to the low sodium diet, table 16.7, page number 339. In the new textbook, it's page number 339. So the first part, the first section is the section which you have to follow if you want to stick to a low sodium content in food, that is less than 25 mg of sodium per 100 gram. Okay, so like for example, things that you can use here as a part of your low sodium diet chart if anyone is suffering from hypertension: bitter gourd, that is karela; wattle gourd, that is what we call as dudi. Okay, brinjal, cabbage, colocasia, cowpeas, cucumber, French beans, grapes, guava, honey, horse gram, lady's finger, that is okra, onion, maida they have mentioned, but it's better not to consume maida because of the fiber issues. And orange, papaya, peas, plantain, that is raw banana. Okay, and banana is different from plantain. Okay, potatoes, pumpkin, ragi, chiku, okay, rava, that is semolina, sweet potato, tomatoes, wheat, yams, watermelon, banana, broad beans, green gram dal, that is moong dal, lentils, mangoes, pineapple, radish, tomato, uh, red gram dal, that is uh, the tuar dal that comes in that small light orange tint color, masoor dal. Okay, so these all are the food items that are naturally low in sodium, which is good for hypertension patients. Okay, and as soon as you go higher up to the other columns, okay, you will see so slowly the sodium per mg per gram increases. So avoid taking beetroot, chicken, like coriander leaves, liver, prawn, bacon, egg, lobster, beef. Okay, these all have high sodium levels in naturally high sodium levels in the diet. Functional foods for cardiovascular diseases. Yeah, monounsaturated fatty acids and polyunsaturated fatty acids in detail we will discuss in the lipids chapter. Okay, from exam point of view, the lipids chapter, it will come. Functional foods for cardiovascular diseases. Vitamin E, carotenoids, vitamin C. Okay, they all are found in all the green leafy vegetables. So green leafy vegetables are a really good source of vitamin E, carotenoids, and vitamin C. Okay, so add a lot of green leafy vegetables in the diet of a heart patient. Okay, broccoli, coriander. Corianders, you can reduce it because uh, don't make coriander based some curries or something. If for garnish purpose, if you are using coriander, it is completely fine. Okay, coriander, some people have the habit of having coriander juice and all, so that has to be avoided. Coriander for garnish purposes, it's completely fine. Okay. Stinking nettle, fenugreek seeds, that methi leaves, dill leaves, perilla, grass pea leaves, leeks. Leeks are like French cuisine. It's not that easily found in India. Amaranth leaf, curry leaves, mint leaves, spring onions, chives, Punarnava. Okay, these all are really good green leafy vegetables, rich in vitamin E, carotenoids, and vitamin C. Coriander has high sodium content. So selenium is found in all the rice, not it is less in white rice. Okay. If you use parboiled rice, ragi and all, okay, if you substitute white rice with parboiled rice, wheat or ragi, okay, you will get more selenium, specifically for South Indians who eat white rice. Okay, there are different types of rice eaten in South Indian cuisine. If you eat only polished white rice, the selenium content is very low. You can switch it with having parboiled rice, wheat or finger millet, that is ragi. Okay, that has much higher content of selenium. Coriander juice is made up of coriander. That's the main ingredient. So naturally, it has a high sodium content. It has to be avoided for hypertension patients. Then all the different forms of soya protein. It reduces the total cholesterol concentration. Okay, it has hypocholesteremic action, like isoflavonoids, genistein, dietine, that happens in soybean. It reduces the LDL levels in the blood. Okay, so soy, anything related to soy is really good for cholesterol patients. Tofu, soy milk, soybeans. Next is beans. They have really good soluble fibers. Soluble fibers will lower the blood cholesterol level by binding with the bile acids and preventing the cholesterol reabsorption in the body system. Pinto beans, this is the pinto beans, which I'm showing on screen. Okay, so it reduces the total LDL levels in the blood. Okay, if regularly consumed pinto beans, it can reduce the LDL levels in the circulating blood. If soya milk is causing gas formation, it means there are high chances are there that you may be intolerant to soya milk. So instead of soya milk, go for tofu. Okay, and see how your body reacts to tofu. Then fruits and vegetables, all the flavonoids present in fruits and vegetables, antioxidants present in fruits and vegetables, small cherry tomatoes, okay, they have more flavonoids as compared to large tomatoes. Red onions, okay, as compared to white onions, red onions are richer in flavonoids. Flavonoids are not easily destroyed by cooking. They can stay. These are the antioxidants that can stay even after being treated with heat. Then having garlic water, fish and fish oils like omega-3 fatty acid can reduce the heart attack risk. Supplements can be taken. Having supplements of fish oil are also as effective as eating fish. Garlic water, just crush one garlic, pour lukewarm water into it, let it sit for 5-10 minutes, and after that, drinking it on an empty stomach. Okay, it will not cure your cholesterol, but it can prevent cholesterol. It has hypo cholesterolic effects. For an extended period of time, if you practice this, it can cause slight reduction, not high, but slight reduction in the cholesterol levels and the triglyceride concentration in the blood. People who have thyroid issues, only they have to avoid taking soya, like that also hypothyroidism, avoid taking soya. If you do not have hypothyroidism, you can consume soya. There is no issue. Nuts are rich in vitamin E. They have high amount of monounsaturated fatty acid, oleic acid, magnesium, copper. Okay, they protect the body against coronary heart diseases. But consume nuts only in small quantities because it is fat forward. It has high amount of fat. Early morning, garlic water, early morning on empty stomach. Crush the garlic, put lukewarm water, 1 glass of lukewarm water or half a glass of lukewarm water over the crushed garlic. Keep it closed for some time. Let it seep in, okay, for 5-10 minutes, and after that, drink the water. Then green tea has polyphenols that can also prevent the coronary heart diseases. Yogurt and milk. Yogurt has high amount of casein and calcium. Both of them has hypocholesteremic effect. They can reduce the cholesterol. In tea, polyphenols are present that can also reduce the LDL levels, oxidation of the LDL levels in the blood. Fenugreek seeds as well. Just like how you consume garlic water, boil fenugreek seeds and strain it out and have the water of it. Okay. It's better to have all the seeds in the morning because these flax seeds are high in fat. Okay. So fat seed and chia seeds as well, they are fat forward. So fat forward things it's better to have before noon. Yeah, green tea is better, is slightly better than black tea. You can still have black tea as well. Green tea has slightly more antioxidants as compared to black tea. High fiber is that is present in fenugreek seeds and oats. Okay, oats have soluble and insoluble fiber, so having oats on a regular basis is good for people who have cardiac diseases. Curry leaves and turmeric also has anti-lipidemic effects to an extent. This is DASH diet. DASH diet can also be followed by people who have cardiovascular diseases. In DASH diet, you can see here a plate has been cut down into different formats. Okay, how much amount of food should be taken? For example, when it comes to legumes, nuts, and seeds, okay, 4 to 5 servings per week. If it is poultry, lean meat or fish, less than 6 servings per day. Anything sweet that has trans fat, less than 5 servings per week. Peanut butter, highly fat laden butter or alcohols, etc. 2 to 3 servings per day of fats and oils. Low fat dairy, fat free dairy, 2 to 3 servings per day, because calcium is important. You require calcium and casein. 4 to 5 servings of fruits per day, 4 to 5 servings of vegetables per day, 6 to 8 servings of whole grains on a daily basis. So this is how DASH diet is formed. Good for cardiac health. So DASH diet, it stands for dietary approaches to stop hypertension. It has been shown that if you follow the DASH diet, you can lower your blood pressure and prevent heart diseases like stroke, diabetes, and even some form of cancer. So the main focus here, if you remember, was to eat more fresh fruits and vegetables and to reduce sweet, reduce trans fat in the diet. Simple approaches, okay? And making sure that on a 2000 kilocalories per day diet, if you are on this diet, these are the picture that I have shown you just now. That's how you have to follow the servings if it is 2000 kilocalories. Okay, if it is less than 2000 kilocalories, you can reduce the servings as well. So regarding red wine, so recent analysis of studies has found that optimum daily intake of wine is around 1 glass, 150 ml for women, and 2 glasses, 300 ml for men. Drinking this moderate amount of wine is associated with health benefits. Okay, so these are the health benefits that wine can bring: boost heart health, raise the omega-3 fatty acid levels in the body, prevent breast cancer, prevent sunburn, boost brain health, and reduces stress, prevents obesity, good for anti-aging, it fights diabetes as well. Okay. Mediterranean diet, very difficult to follow in India, because if you look at Mediterranean diet, majority of the Mediterranean diet is made up of raw fruits and vegetables. Okay, in Indian diet, it's usually cooked fruits and vegetables. Okay, so Mediterranean diet is like, on paper, it looks really appealing and good, but to follow this diet in India, it is very difficult. Based on Indian cuisine, based on what we Indians are used to, following Mediterranean diet is very difficult. Okay, so occasionally small amounts of meats and sweets are provided in Mediterranean diet on a daily or weekly basis. Dairy and poultry, meat, okay, fish and seafood. Olive oil and red wine is used on a daily basis. Fruits and vegetables on a daily basis. Grains, breads, legumes, nuts, seeds, beans, daily basis. Physical activity and eating with family. That is just a top on additional point on it. But this is how you follow Mediterranean diet. But very difficult. The fruits and vegetables we have mentioned here are in salad form. Okay, not majorly it is cooked. It is in salad form. Okay. Some other dietary guidelines which you can follow for cardiovascular diseases. Hypertension and all, these are the same principles will be there. Hypercholesteremia, hypertension, heart failure. In detail, we had discussed in the last week's Wednesday classes, okay, about different types of cardiac diseases. So we'll not repeat it here. Dietary guidelines will just go through once. So patient should maintain a good body weight. If they're obese or overweight, they have to reduce their weight first. Only then the heart health will get better. So they should know their energy requirement, and based on that, based on their lifestyle, they should consume the food appropriate to their energy requirement. Variety of food should be given for cardiac patient, which are low in fat, saturated fat, cholesterol, and trans fat has to be completely avoided. No chance for trans fat, like bakery items should be limited, soft drinks, cold drinks. Vegetable oils are promoted, like safflower oil, sunflower oil. Okay. olive oil, and solid fats should be avoided. For example, coconut oil, butter, ghee, these are solid fats. Small quantities of almond and walnuts can be consumed on a daily basis in a very reduced quantity. Coconut oil is restricted. You don't have to be avoidant of it. You have to restrict the use of coconut oil. Okay. Egg yolk has cholesterol, so eggs can be, you can have the egg white, avoid egg yolks. Meat, pork, beef, which are high in saturated fatty acid and sodium as well, avoid it. You can use chicken instead of red meat. Shrimps and crabs can also be taken, that they also have less fat. All seafood is rich in sodium. So if you like fish, try to eat freshwater fish as compared to the sea fish. 2 servings of fish on a daily basis is beneficial. And people who do not eat fish, they can consume fish liver oils, the capsules. Take skimmed milk or low-fat milk, not the full-toned one. Olive oil, which contains monounsaturated fatty acid and phenolic compounds, have favorable effect on blood lipids. So add more olive oil into your diet. Boiling, steaming, grilling, and baking without fat are preferable as much as possible for cooking. At least 5 servings of fruits and vegetables on a daily basis is required. Fruits and vegetables can also be taken as snack, like a snack on a cucumber, snack on a fruit. Okay, instead of having fried snacks. Consume more carotenoids and vitamin E rich food for their antioxidant effects. Add more fiber into the diet, like having raw salad, raw fruit, sprouted grams. Isabgol can also be taken if you wish to, if you can't have more fruits, use switch to isabgol. Try to reduce taking pickles or preserved food, and reduce empty calories like cold drinks, soft drinks, alcohol, sugar. Artificial sweeteners can be included in diet occasionally. Coffee and tea should be in moderation. Excessive amount of caffeine also increases heart rate, so coffee should be in moderation. 20 grams of isabgol on a daily consumption, you can start with that.